Hello and welcome back. I'm Dr. Joel Banker, and today we are going to discuss a very important topic which many of you are curious about, and that is PCOS. So in this video, you will understand what is PCOS, what are the symptoms you should look out for, and how you can effectively manage it. So let's start. So what is PCOS? PCOS stands for Polycystic Ovary Syndrome. Now, is it a disease? No, initially it was called Polycystic Ovary Disease, but as it is not a disease and just a collection of certain symptoms, now it is called Polycystic Ovary Syndrome. It is a common syndrome affecting around 10 to 15% women worldwide, and it is caused by an hormonal imbalance, especially the excess of male hormones in your body, which are called androgens. Now, these androgens interfere with the hormonal signaling in your brain, and because of this irregularity in the hormones, there is irregular ovulation. As there is irregular or no ovulation, there is an accumulation of certain follicles in your ovaries, and these follicles look like tiny cysts on an ultrasound. Because of that, the name polycystic. Now, this syndrome can cause a variety of symptoms, and this can differ from person to person. If you are experiencing irregular periods, excessive weight gain, acne, excessive hair growth, or even facing issues with fertility, then you might have PCOS. It is also believed that PCOS only affects overweight women, but this in fact is not true. Studies have shown that around 20% of women who have PCOS are thin and lean. So medically, how do you diagnose PCOS? Diagnosis is based on three criteria. If you have any two of these three criteria, then you have PCOS. The first criteria is excess androgen levels. Now, this can either be clinically, that is acne, hirsutism, or excessive hair growth, or biochemically, that is a blood elevated levels of androgens. The second criteria is oligoovulation, that means irregular ovulation or even no ovulation at all. And the third criteria is the polycystic ovarian morphology, which is the typical polycystic appearance of the ovary on an ultrasound scan. So if you have two out of these three symptoms, then you have PCOS. Now let's talk about the symptoms of PCOS. Irregular periods or even the absence of period is the most common sign. You might also experience weight gain, especially around the waistline. Now, this excess androgens acts on your sebaceous glands, which are tiny glands present in your skin, which causes them to secrete excess amount of oil. Now, this excess oil can clog your pores and hence those acne breakouts. This excess androgen also acts on your hair follicles, and due to that there is excessive production of coarse and dark hair. This hair is seen more on the face, chest, and even on the back. Not all women experience all the symptoms, but you should be aware of them. But there's good news. You can take control over PCOS and its symptoms through simple lifestyle modifications. Regular exercise, including cardio as well as strength training, causes your insulin sensitivity, and this can help in hormonal balance. Even a 5 to 10% reduction in your body weight can go a long way. Combine that with a healthy diet, focusing on whole grains and portion reduction, and you're on the right track. So insulin plays a big role in the symptoms of PCOS. By exercising regularly and maintaining a good lifestyle, you can improve your insulin sensitivity and get rid of most of the symptoms. Now, having regular and predicted periods is essential for a good quality of life. If you still have irregular periods in spite of these lifestyle changes, then you might need medication. If you are not planning a pregnancy, then regular hormonal monthly pills can help you ovulate and get regular periods. If you are planning a pregnancy, you can start taking ovulation induction medicines such as letrozole. Because of these medicines, you ovulate regularly and get a period as well as have a chance of a pregnancy. So you should consult your doctor and discuss what's right for you. Now, one of the most heartbreaking aspects about PCOS is its association with infertility. But don't lose hope. There are many treatments available, ranging from simple ovulation induction medicines to more advanced treatments such as IUI or even IVF. You should discuss with your doctor what treatment is right for you, and a personalized treatment plan based on your symptoms, your age, and other associated conditions such as male factor should be made. The good part is that you have PCOS. That means you have a good number of follicles in your ovaries and you have a good ovarian reserve. Hence, you have a good chance at pregnancy. Now, dealing with acne or excessive hair growth can be quite challenging, but there are certain things you can do to effectively manage these symptoms. A good skincare routine using non-comedogenic mild products and regular moisturization of your skin using oil-free products is essential. As for excessive hair growth over the body or for unwanted hair, temporary methods such as waxing or shaving are good, but permanent solutions such as laser hair reduction are more effective. This procedure targets those hair follicles which are activated by the excess androgen levels in your body and inhibit their growth over time. So I hope you have a clearer understanding of what PCOS is, what you should look out for, and how you can effectively manage it. If you have any doubts or there are certain topics which you would like me to cover, do leave them in the comments below, and thank you for watching.